Here in Florida, hospice care is regulated by the Florida Agency for Healthcare Administration, and there are 4 primary levels of care. Dr. Michael Shapiro with Cornerstone Hospice has joined me to explain these 4 levels of care. And Doctor, thanks so much for being here. Now, we're going to give these examples of the 4 levels, but we're going to start at the beginning. Someone has been referred to hospice. So what happens as that first step?
Well, thank you for having me. When somebody is referred to hospice by their primary care physician or even a family member is requested a referral, what happens is a member of the hospice team, our admission team, goes out and visits with the family, with the patient, and does a full assessment about their current conditions, what has led up to the referral. Maybe it's a more sudden diagnosis, something longer standing like a dementia, there are Alzheimer's disease that has progressed. And it's a comprehensive assessment over all of the needs, all of the current treatment plans, and the patient's current situation with their condition in the setting that they're at. Could be their home, could be a nursing facility, wherever they're at.
Okay, so basically that person comes out, puts together a whole care plan for that individual, and then, involving their family.
Yes, and the care plans in hospice are extremely important. And what they would do at that point in time, with an appropriate admission, of course, is develop a treatment plan, develop a care plan that is specific to that patient for any symptoms they might be having at that time, or any concerns or conditions, stress that the caregivers might have at that time. Could be related to wounds, could be related to assistance with activities of daily living, such as bathing, such as putting on one's clothes, those types of things.
Things like that. But we want to get into those 4 levels, and I think folks may not even realize, they've kind of heard about hospice and what's involved, but there is kind of a progression of levels. So we're going to take an example. This first level is routine home care. So what's involved with that?
So of the 4 levels of care in hospice, routine home care is the most common. And this is for a patient that is usually stable. We'll take an example of dementia or Alzheimer's disease that has progressed to the terminal phase. They're appropriate for hospice, so they have a prognosis of 6 months or less.
Right.
But they're at home, living with their family, caregiver, spouse, whoever it might be, and their needs are at a more stable level. They are not uncontrolled, out of controlled symptoms such as anxiety, and it is what it would be considered, as the name states, routine home care. Anything associated with that, medications, any type of basic needs like wound care can be addressed at that level of care.
Now, is this a 24-hour, 7-day-a-week type of care at that level?
At a routine home care level, it is not that somebody will be in the home, staffed at the bedside, 24 hours a day, 7 days a week.
Okay, so we move on then. The second level, continuous home care. So how does this change?
So when an individual, such as our patient, will say with Alzheimer's disease, they were at a stable condition, they were at a stable state, maybe they got agitation. It was initially dealt with, which can happen in Alzheimer's disease, but it progressed. And it progressed to where the needs, the medications, the treatment plan for it was a bit beyond what the caregivers in the house could supply. And so hospice can then bring into the home what's continuous home care for this skilled need. It's at a minimum of 8 hours out of a day, can be 24 hours a day, and it will have a staff member in there. But it has to be when that symptom is uncontrolled. So it's a transition from, say, routine home care to continuous care.
So that's the second level. We go on inpatient care.
Yes.
What happens here?
In the same individuals we're talking about, we went from routine home care with a little agitation. It definitely got worse. It goes to continuous care. We have staff at the bedside giving, let's say, medications by mouth. Okay. Then it gets even worse and continues to where even at the bedside in the home setting, it needs a higher level of care. So general inpatient care, which is that next level, occurs. Some people have heard or seen hospice houses or hospice units. That is an inpatient level of care. It can also happen sometimes in a hospital or a nursing facility. That's slightly more uncommon. Normally it's in a hospice facility. And this is where you might transition to things like intravenous medications every hour, those types of needs where the skilled level has greatly increased.
Right, something a little more involved. And then the 4th level, which is then finally the respite care.
Yes, now, interesting, respite care is not directly related to uncontrolled symptoms, but in this same individual, maybe we went from routine to continuous to GIP. The symptoms get stable and they return home, but the patient's caregivers, the spouse, the family, they have things that they need to adjust to. Could be their own personal needs, could be a break because it's very stressful. Respite care is a 5-day stay, up to 5 days, that is placed in a facility, can be a nursing facility, sometimes a hospice facility, and it's at a level of care, and the purpose of that is just what the word says, respite, and it is to support the patient's caregivers and loved ones so that they're able to attend to needs that they need to get to.
Right. It's such an important part of the family plan as well. And Dr. Shapiro, thank you for explaining the levels of care that are the cornerstone of the hospice care model. This is such great information for families. Thank you for being here.
Thank you.